going to be a mid-cervical thrust manipulation. Mid to lower. Go C5 right here. Typically other ones will manipulate as well that I like. So if I'm going to be coming down here, I'll figure it out with UPAs or some type of supine assessment where their symptoms are, where I think that we should go. So I rotate just a little bit at first. Just a little bit of rotation so I can be there on the pillar. I don't want to be on the transverse process. So a little bit of rotation, 15, 20 degrees or so. I'm going to side glide, side bend, and then I rotate right there. Now the key is that we don't maximize all of those. So if I side glide there, I come off of it a couple degrees. I side bend, I come off a couple degrees. Then I rotate, come off a couple degrees. This way, he's comfortable. He can take a nap right there. I can see it in his eyes. I want to make sure he's comfortable. You say, well, you need to know where is the barrier there. But if I put my hand on his shoulder and I come off half an inch, I know where his shoulder is. Now, if I'm way out here, I don't quite know where his shoulder is if my eyes are closed, and I can't see inside his neck. But if I come off just a little bit, I still know where it is. And so if you said just tap him, I could, where if I'm way out here and I can't see his shoulder, I may hit it too hard. So it's not a lot of momentum induced. We want to be just a few degrees off, so where you know it. So I know it's right there. And so that way, come off where it's comfortable. And then when I go through, it's quick right there. We got a few cavitations right there, right at that about C5 area right there. And so the key is speed there, and that's to be comfortable before. If it's comfortable before, and then the speed there at the end. But make sure it's set up well, but that speed can be challenging. That is the athletic maneuver of this. We can teach the setup. Getting the feel for it can be challenging, but that speed there at the end is the athletic portion of it. It really takes a lot of practice. A lot of the rest is, understanding what to do, getting help on the feedback on the technique. That last little bit is the athletic portion of it. And the more necks you feel, the better you'll get. Some people will get real easily, and some of the more difficult ones are pretty stiff, or some of it's pretty mobile, and then some of it's stiff. Those are going to be your harder ones. And the better you get, the more often you'll get them.